Do you ever experience your leg just involuntarily bending? Well, I know for some of you that this is true because you share your situation in the comments, and this does seem to be a common problem that comes up. So I thought that is what we will go over today. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility and health in the context of neurologic conditions, with the goal of empowering you with as many tools as possible to reach your mobility, health, and fitness goals. And all that being said, today we are going to talk about a knee that just always seems to want to bend. Now, there's a few different conditions that I'm going to kind of lump into one that I see come up in the comments. One is when you go to stand on the leg just seems to want to buckle. The other one is, and this has come up a couple of times just in the last week, the leg wants to draw up off the ground. So when you stand up, your knee just bends and the leg actually comes up off the ground. So whether you have a leg that seems to want to buckle or just bend every time you stand on it, or you have a leg that bends and actually comes off the ground, I'm going to talk about why this might be happening and, of course, give you some solutions to help keep that leg straight when it needs to be straight when you're walking. So first, let's talk about what are some of the things that might cause your knee to bend when it needs to stay straight when you're standing on it. The first thing that comes to mind is just weakness. So in the really early stages of stroke recovery or brain injury recovery, when the muscles are really, really weak, when you go to stand on it, obviously the muscles can't keep the knee straight. The leg is just going to bend. So that is the most obvious reason why your knee might bend when it should stay straight when you're standing on it. So if that is you and you feel like you're either in the early stages or your leg is just really floppy or what we call low tone, best thing to do is some mat exercises to rebuild the strength or the control in your knee muscles and your hip muscles. This is a hip external rotation exercise, extremely important in any stage of rehab where you're really trying to improve your walking on uneven terrain, or maybe you're not standing or walking yet. Getting those external rotators really engaged is really important to stabilize the body when you do get to a point where you're walking. So you can see I did this without any kind of resistance. Always good to start with the easiest, and then as you can gain confidence and know that you have good form, start adding resistance. So again, laying on your side, knees bent up. The key to this one is just making sure you don't roll onto your back when you're bringing it up. Really make sure you're isolating that hip. This exercise is what we call a short arc quad. Super, super important exercise, especially for those of you that have an abnormal flexor synergy pattern. A lot of times it's really hard to isolate that knee extension. So the key to this one is really thinking about pressing your knee down into that roll and trying to initiate the movement by lifting your foot. A lot of times people will lift their whole leg up. So what you'll feel is you'll feel the knee come off the roll first. You really want to make sure your heel feels like it's coming off of the surface first. Now, this is part of an extensor synergy pattern. So if you're someone who has a tendency to lock your leg out or your foot has a tendency to point, you definitely want to wear your AFO. Remember, most of the exercises that we do where we're isolating movement, we're trying to break up those abnormal synergy patterns. So for this one, if your foot has a tendency to point, then definitely wear your AFO or wear a night splint when you do this exercise. So again, pressing your knee down into the roll and just tightening that thigh muscle up, trying not to let that knee come up first, but really making sure that the knee goes down and you think about lifting that foot first. So for this exercise, what we're doing is we're isolating knee extension, so straightening that leg out. You can see I do have something on my foot. I recommend if you are someone that points really hard or you have spasticity in your calf muscle that you do wear your AFO or your night splint. Again, this is to relearn how to isolate that knee and not have that foot point every time you're trying to straighten your knee out, which is problematic when you walk and can also cause your knee to go into hyperextension when you're standing on that leg. So again, you're straightening the knee out with something on your foot to keep it flexed. This is for those of you that have severe spasticity and you don't have the ability to actively lift the foot when you straighten the knee out. In addition to those mat exercises, you want to do kind of a progression of loading activities. You don't want to just go right into walking, or you want to try to kind of gradually build up to loading the leg. And the reason I say that is because a lot of times if you're weak in the muscles that keep the knee straight, you'll start just popping your knee back into hyperextension. That is kind of a compensatory strategy for weakness around the knee muscles. Your bones kind of just all lock on top of each other and your knee will stay straight. If you get into the habit of that, you're kind of discouraging or not encouraging the use of the muscles that keep the knee straight. That's one potential problem. And then the other potential problem is that you'll start to actually damage the back of the knee. So I always recommend that you do some progressive loading exercises, starting with some weight shifting, then some heel lifts, then some stepping. So for this activity, what we're trying to do is create structures to provide a little scaffolding around our body. What you're doing in this case is you're giving your brain and your body the experience of what it feels like to have everything lined up, and then holding it lined up is where you develop that motor learning or that motor training component so that you can help keep it there when you do carry this over into walking. So really just standing in place is the beginning step of figuring out how to engage the muscles in the leg. So a sturdy structure on the involved side of the body is the first component of this. So even if you can't use your involved arm, that's okay. Right now, all we're trying to do is learn how to shift the center of gravity over one foot. That is step one with any single leg standing activity, or I use this for a lot of different what we call pre-gait activities or activities that are good to practice before you actually start walking, and that is just a weight shift. Now, a lot of times people know that they need to get over, or my patients a lot of times know they need to get over, but what they'll have a tendency to do is just move their hips over and keep their upper body still over here. So you really want to make sure you keep your body aligned and you're moving your center of gravity in a vertical line over the involved leg. That is step one, with your belly button as close to the center of the foot as possible. And then you can start unloading the uninvolved leg, or in other words, loading the involved leg, and then start with those heel lifts, unloading that uninvolved leg, and then progress to the stepping. And then in addition to that, you want to start working on little mini squats where you start with your legs straight and then you bend it a little bit and then return to standing, bend it a little bit more, return to standing with some sort of setup that biases the weaker leg. So you can either set that leg up on a block and do it that way, or you can stagger your stance with the leg that you're working on just a little bit further back. So that would be the standing progression that I would recommend. The other thing that I see where people just can't keep their knees straight when they're standing is from a condition called Idiopathic Polyneuropathy. It is a condition that I'm seeing more frequently as an actual diagnosis on the doctor's script. And basically that just means there's not good signal in the nerve that leads to the muscles for the people that I see that actually go to the ankle. So even though you're bending your knees, in my opinion, what I see in my office, it's usually because there's weakness in the ankles. So I hope I can make this connection for you really quickly because it's not super common. I know there's a lot of you on this channel that this probably isn't going to apply to, But what happens is when the ankle muscles are weak, the ankle muscles are responsible for kind of keeping our body balanced over our feet. When we fall backwards, the muscles on the front of the ankle pull us forward. If we fall forward, the muscles on the back of the ankle pull us back. And we call those ankle balance strategies. So they're very quick and they're automatic. They're not something we really think about. Well, when those muscles are weak, you lose that ability to kind of correct your balance if you lose your balance forwards or backwards. And our brains are pretty intuitive. And when we lose that ability, what we'll quickly do is just bend our knees. What that does is it just positions our body a little bit more centered over the middle of our foot. So I do see that a lot. So that's not a huge percentage of you that watch this channel, but if you are someone that you can't figure out why you just always want to bend your knees when you're standing and you have polyneuropathy, that could be the cause. So the reason I bring that one up is just because the best thing that I have found for that specific issue is bracing. They make a few different ankle braces that work really well. If you find that your ankles are really, really weak, the most aggressive bracing would be what we call a floor reaction AFO, which I find to be the most effective for this. It's a very lightweight brace. It's carbon. Most insurances pay for it, but it kind of puts a shelf on the front of your leg and it just kind of creates walls around your shin bone to help you maintain your balance without really requiring those ankle muscles. If you're in the earlier stages and you still have some strength left in your ankles, the brace that I find to be super duper effective is the TurboMed X Turn. I will put a link for that brace in the description below. I believe insurance also pays for that one, but that one is one that actually goes on the outside of your shoe. So some people prefer that one, and it's more of an active assist brace. Very, very effective for those of you that have polyneuropathy that is impacting the strength in your ankles. The other thing that can cause this to happen is a Flexor Synergy. Now, I've talked about this before, but it is coming up in the comments, so I think we have a lot of new subscribers, so I thought I would just go through some of my thoughts on that again. Some of this is just repeat information, but for those of you that are new, a Flexor Synergy pattern is just involuntary muscle contractions, and in this case your hip and your knee just bend involuntarily. And so if that is you and you find that your leg is coming up off of the ground, then you would want to do exercises isolating the hip while keeping the knee straight. That is breaking up an abnormal synergy pattern. Now, when it comes to standing, the most effective strategy that I found that works is using a knee immobilizer initially. Just getting your body used to standing without that Flexor Synergy kicking in. So I will put a link for a knee immobilizer in the description below. They're fairly cheap. And again, I only recommend this for those of you where your foot just will not stay on the ground. It's not really super ideal because there are points in the walking cycle where you do need to bend your knee. But if you literally cannot keep that leg straight and standing, I highly recommend just work on standing with a knee immobilizer on your knee. And again, I will put a link for a knee immobilizer in the description to this video. And then the other thing that I see where the leg just seems to want to draw up off the ground when you're standing is what we call like a flexor withdrawal. So sometimes your leg will just flex up in response to some kind of a uncomfortable or painful stimulus. I actually had a patient recently that this was happening to, and if she dropped anything either on her foot or near her foot, the whole leg would just draw up off the ground. If that is you, just be aware that that's going to happen and try to avoid bumping your foot into things or letting things fall onto your foot. And then for that, I just recommend wearing shoes that have some kind of a more protective surface on the top of them, some kind of a leather. The New Balance Velcro shoes that most of you don't like, but they're very, very effective because they have that harder leather. A regular running sneaker, now a lot of them are more cloth-like on the top, and that might not be as good if something were to land on your foot, and that can be really problematic. I mean, you can't always control someone dropping something and near you or being out in public. So just being aware that that could cause your leg to flex up, and just taking that added precaution of wearing a more protective shoe. So I hope that was helpful. If you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell. I enjoyed spending time with you all today, and I will see you in the next video. Have a good day.